Good afternoon, everybody. Eli Perry here again for another video on Video Free America. Before I get started, I want to apologize for the slightly echoey audio that you can probably already hear. I'm not in my usual filming space anymore. Well, not this time. I'm in a different room of the complex that I normally use to do this. One of my commenters on an earlier YouTube video asked if I was filming in a bathroom. No, I'm actually filming in a classroom at my workspace. Um, and we are still in the process of getting it decorated and ready for the year, even though that started 6 weeks ago, which of course means it's a bit echoey. I wanted to take today to specifically engage with something that happened to me over the summer because I think it would be a useful example, a working example of how to analyze things like propaganda and closed media spaces and things like that. If we took my experience over the summer and applied it to what is one of the most heavily propagandized, propaganda-influenced discussions in the United States, which is the ongoing, incredibly vitriolic discussion around healthcare access. Because over the summer, I had a very interesting experience. Shortly before the end of school, the last week of June, I had to have my appendix removed. Fortunately, the issue was caught before my appendix ruptured, so it wasn't as bad as it could have been. But it was still an emergency situation. An ambulance ride was involved, an x-ray was involved, a sonogram was involved, some pain medication, some antibiotics, and a couple of cubic feet of nitrogen gas, along with the talents of a team of beautifully trained surgeons, nurses, anesthetists, and care specialists. And so I wanted to engage with this in a way that would give my American viewers, all 6 of them, a little bit of information about the way that healthcare actually works in a post-communist country, so in a quite conservative, center-right sort of country, as compared to the United States. And I want to address the question of national political character first, because one of the alternate realities, one of the false realities that is current in American center-left through right-wing propaganda spaces is that universally accessible healthcare is largely a feature of left-wing socialist or semi-socialist or social democratic states. They tend to look at countries like France, which is not left-wing at all, but that's for another day, or the Scandinavian countries, which are left-wing, but are European-style left-wing, not American-style left-wing, which is also a story for another day. But the Czech Republic is not a leftish country. There is a left here. There is a far harder left than in the United States. What most Americans consider to be the mainstream left, which is the Democratic Party, and the left wing of that party as personified by people like Bernie Sanders, Ilhan Omar, et cetera, et cetera. In most European countries, that would be considered somewhere between a center-right and a center-left party. But the hardest left wing of the American Democratic Party would be considered a centrist party of some variety, pretty much anywhere in Europe. And healthcare is a great example of that. If you go to most conservative parties, right-wing parties in Europe, they will tell you that national health care of some sort is an absolute priority for them. It is a conservative priority and position to make sure that the national healthcare system is well-funded, well-organized, well-administered, and easily accessible to ordinary people. And the reasons for this are twofold. Right-wing parties value capitalism. If all your workers are sick, they can't make stuff in the factories. If they're not making stuff in the factories, they're not getting paid. If they're not getting paid, they're not buying anything. Bad health outcomes affect the money flow. They affect capitalism. Conservatives don't like that. Also, if you don't have healthy soldiers, you have to get them healthy. Or you have an unhealthy army that cannot defend your country's sovereignty and its interests. So over here, easily accessible public health care is a conservative position. How to administer it, how to go about it, what procedures or things should be covered. That's where the argument between left and right is, not over the existence of the system. And the healthcare system that I'm a part of here in the Czech Republic is remarkably similar in some ways to the Romney care system put out by Mitt Romney in Massachusetts, which was the model for the Affordable Care Act, aka Obamacare. The difference is over here it works, and it works for everybody. So before I get into what this means, let's talk about the economics. Let's talk about how the bills get paid and how the lights stay on. Right here, I have my VZP card. I'm not going to get into trying to pronounce that or explain what it is, but this is my health insurance card. Now, this is a private health insurance company that I'm covered by. It's one of about half a dozen private but non-profit health insurance companies that exist as part of the state system. Over here in the Czech Republic, we are required by law, just as in Romney Care or the Affordable Care Act, to have health care coverage. It can be public, it can be private, but we are required by law to have it. Most people go with, at least initially, the public option because it's cheaper. Now, my semi-public healthcare, public hospitals, private insurance works like this. I'm a private contractor. I'm a freelancer. What that means is that I pay very, very, very low income taxes. I pay 12.5% income tax. Yeah. Now that doesn't cover my health insurance or my Social Security contributions because under the Czech system, those things are paid by a person's employer. My wife works for a different school in another county, and she has a full, proper contract job. So her school, her employer, pays her health insurance, and they pay her Social Security, and they also pay taxes on her employment. Her income tax is a little bit higher than mine because she's on a contract, but really we're in roughly the same ballpark. But I pay around $100 US a month for this beautiful little card. Now remember how a second ago I said that the deal was that the hospitals were covered by the state, but the insurance was private? That's the way this works. The hospitals are effectively in network, for you Americans, for the partly subsidized nonprofit health insurance companies like VZP. All private hospitals also have to at least cover some things like emergency care from VZP. Private insurance is accepted at all state hospitals. Some private hospitals do not accept they don't accept VZP for most things. They're private, they get to do that. And it is a fairly common thing for Czech people to carry private supplemental insurance just in case. Just in case they need an elective surgery. They want to get a liposuction, for instance. Well, you're going to wait 6 or 7 months to get a liposuction because that's not really a life-saving procedure. Maybe they want to get it done this month, so they have private health insurance coverage to do that. This is very, very common all over Europe. And the private health coverage it's a little bit more expensive, but it's certainly nothing like what we were paying in the United States. 8, 9 years ago, 10 years ago, before we moved here, back in like 2015, under Obamacare, my wife and I were paying more in the United States than we would for private health insurance here. I pay about $100 US a month. And what does this get me? Well, let's talk about my appendectomy. It was a little bit complicated because the first doctor who saw me, English was about his fifth language, and I think Czech was probably his fourth language, and he didn't quite understand the situation I was in, and he did not do the correct imaging procedure. He sent me for an X-ray instead of an ultrasound, and I think it was because he was looking for things like kidney stones, gallbladder obstructions, things like that. He wasn't really looking for appendicitis, but he said for me to come back the next morning to have a blood test done and to double check everything. So I went home. I came back the next day, I got my blood test. The doctor, a new doctor this time, poked and prodded, sent me for an ultrasound, found the appendicitis, and about an hour later I was waking up. They got me in, cut, fixed, sewn up, and back in my room waiting within about 2 hours from the doctor first looking at me and sort of poking at my stomach. So 2 hours to get the whole thing done and dusted. The previous day I had arrived in the hospital by ambulance, and the day after this I went home. So there's an ambulance ride, there's pain medication, there's an x-ray, there's the consultation on Wednesday. Then on Thursday, there's another consultation, there's an ultrasound, there's some antibiotics, there's some more pain medication, there's the operation itself, there's a night in the hospital, and then the next morning there's a big 400 milligram ibuprofen before they shove me out the door. You want to know how much I paid for all that? 90 Czech crowns, which is about $3.50 US, on top of my $100 a month VZP. Any of you Americans starting to feel your sphincters contract a little bit as I was running down the list of things there? You're starting to see this flashing image of a hospital bill in front of your eyes, and next to every little thing there's a 3 or 4 or 5 digit number. Yeah, I was. Because I have another interesting comparison that I can make when I'm talking about this. And this is the comparison that I always use to explain the difference in American healthcare, Czech healthcare, to both Czechs and Americans. And that's my 2 children. My oldest daughter was born in Watauga Medical Center in Boone, North Carolina. And my younger daughter was born in Nemocnice Kolín, in a town about the same size as Boone. So we're looking at 2 facilities that serve similar sized populations and are both basically county hospitals. And in both cases, the birth was an emergency cesarean section followed by 4 days rest and stay in the hospital. So this is a very apples to apples sort of comparison. I don't know what our final bill from the oldest one's birth was, but after we had paid our $2,000 insurance deductible and after Blue Cross had covered 80% of what was left, we still owed 5 figures. And it took us a couple of years at least, I think it was 4 years, to pay her birth off. We paid $400, 8,000 odd crowns, about 400 US dollars for the birth of our second child. And this one also included an ambulance ride at about 11:30 at night. Let's take the smallest 5-figure number there is, even though I know it was 2 or 3 times this at least. 10,000 US dollars versus 400. 1/20th the cost. Now, a lot of people in the US will be saying, well, yes, but you pay for this through ridiculous taxes. No, I don't. Like I said, I pay 12.5%. The first 60% of every paycheck as a freelancer is a tax write-off. And I pay 15% income tax on the 40% that is left. How'd you like to pay 12.5% taxes plus $100 a month and you get you a card that makes your appendectomy, your abdominal surgery, a $5 proposition? How'd you like to pay 12.5% income tax and $100 a month and pay $10 or $15 for a Z-Pak or a course of azithromycin, excuse me. How'd you like for your doctor to trust you enough that when you have bronchitis, they give you a 25 pack of codeine sulfate tablets just to make sure you can get some sleep, because they understand that sleep is important for your well-being and your recovery. We've had problems with the Czech healthcare system. Every system has problems. But the propaganda around healthcare in the United States is so intense that people believe that for all of its issues, the American system is as good as it can get. And that's just plain not true. I've just shown you. Now, you can disbelieve me if you want. I'm just a guy on the internet. But you can also look around. You can trust but verify, but just fucking verify. And you can see that this is true. I don't know what the situation is in other countries, but in my little funny center-right post-communist country, this is how it works. And this is how much we pay for it. And this is the result that we get. Now, comparing the two births, yes, there were some differences in the style of healthcare. When little one was born at Watauga Medical Center, my wife and I and the baby, we had a room all to ourselves. This was not the case at Nemocnice Kolín. My wife was on a ward with, I believe it was 4 other women with newborns. She said she actually found that, despite the language barrier, a different experience, and in some ways a better experience than being in a private room, even if it was just with me, because there were all these other new mothers around. You're all struggling together, you're all having similar experiences, and even if you don't speak the same language, there's some solidarity in that, which she seems to have found, perhaps comforting is the wrong word, but different than the much more solo experience that we had in the United States. When I had my appendectomy, the one night that I was in the hospital, I had a roommate, nice older gentleman. So maybe the infrastructure is not quite as new and pretty and shiny. But you know what? When I left the day after my appendectomy, my stitches didn't come undone. I didn't get a hernia. I didn't have any infections. I didn't even have any pain. I never took the big ibuprofen pill they gave me. I looked about 6 months pregnant because I was still blown up with nitrogen. But other than that, and being dog tired for a week and a half or so, I was okay. All the extras in American hospitals are nice, but they're nice. They're not necessary. Here, my $100 a month gets me absolutely everything I need. And a lot of Americans will talk about how, yes, but over here, the government can turn off your health care and they can, use death panels and blah, 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 blah. I mean, technically speaking, that's true. Those things could happen, but they're already happening in the United States. I've shown my Czech clients and friends and coworkers news stories from the United States about how people who can't pay, as soon as they're stabilized, and ask any of your EMT friends just how bad stable can still be. As soon as they're stabilized, they're literally dumped on the street. There are photos of this. There are videos of elderly people, wheelchair bound, unable to care for themselves, being wheeled out onto the street in front of the hospital, tipped out of the wheelchair, and left there lying on the street in a hospital robe. I'm not saying that is super common, but over here, it would be impossible. Yet it's a thing that happens in the United States. I had an interesting discussion with a person on Reddit about a month ago about this issue. They were wondering why Americans don't take little vacations a couple of times a year, take a long weekend, take a 4-day weekend and go camping or go to some minor local tourist attraction. And I said, well, a lot of Americans do that, but a lot of Americans can't. And this person was Australian, and they basically said, of course they can, just use your tax return. And I said, no, dude, you don't understand. For a lot of Americans, the tax return is what pays their health insurance bill for the year, or it might be what keeps the electricity turned on for the year. They can't use that for holidays. And this person simply did not understand that, number one, most Americans get their health insurance from their job. Number two, being fired for being sick too much is legal in the United States. And number three, if you lose your job, you lose your health care, which means that instead of being on the hook for 21 or 22% of your hospital bill, suddenly you're on the hook for all of it. This person did not understand that. They thought that the system they have in Australia or something like it was universal or near enough. And they simply could not understand that, no, that's not true. Americans, you've been propagandized. Not so much about the state of your health care, because you all know what that is, but about the state of everyone else's. This is not unique, but an interesting propagandistic rhetorical trick that is pretty common, but you really start to see it in the Soviet Union under Brezhnev, when things started to stagnate and the sort of forward progress that had been going on for a couple of decades by that point started to stall. You see it in North Korea today. It's a very common rhetorical trick of dictatorial or authoritarian regimes to say to their people, yes, of course we have problems here. Everywhere has problems. You're not stupid, comrade. But just think, look how bad the dysfunction is here, and we live in the workers' paradise. Think how horrible it must be out there in the outer darkness of capitalism. Look at how dysfunctional and pain in the ass things are here. Turn it up to 11, Tavarish. That's what the poor Americans and British and French workers go through. Aren't you glad you live here? This was a major point in a lot of Soviet propaganda, to the point that the film version of The Grapes of Wrath was banned in the Soviet Union. I explain that to Americans who've read The Grapes of Wrath, and they don't understand why, because The Grapes of Wrath is one of the great left-wing socialist or social democratic polemics in the history of American literature. And I say that as a non-leftist. It's a beautiful piece of propaganda, partly because it's all true. It's fiction, but it's fiction describing a real circumstance. But it was banned in the Soviet Union. Americans never understand why, until I explain to them that, yeah, the Jodes and the other itinerant farm workers who are the focus of the story are very poor and they're very oppressed, and that plays really well into communist propaganda. But you know what doesn't? The fact that the poor, oppressed, migrant farm workers had their own cars. The Soviet Union did not dare let their people see that the poorest Americans in the worst time in the 20th century had access to private cars, because private cars were not readily available under the communist system. My American friends, you're being lied to and propagandized in exactly the same way when it comes to your health care. Other places have problems too. Every place has problems. That's just a fact. And anyone who tells you that their system is perfect is either delusional, stupid, or lying. But the people telling you that the way you have it is as good as it can get, those people are lying to you. They're doing it in a very, very communist sort of way. It's very interesting, isn't it? The so-called right in the United States acting more and more like communists every single passing day. And that's going to be an interesting theme, because I've got a story I'm working on now trying to track down and verify that, yeah. But as I say, check out what I've said. Look at what other systems are actually out there. Talk to people who actually live with those systems. Don't trust but verify. Just fucking verify.